approach build intake and diet and exercise and by the administratively prescribed slow softener.
What about fail?
Consult consideration of the procedures with the patient and family. Maintaining good ventilation and flexibility. It may be difficult to understand some non-Western pain remedies, so it is important that the patient feels free to ask for what is needed. During the assessment process, explore how the patient feels about the combining therapeutics, therapies, therapies, so that the patient is made familiar with a range of pain treatment options. In traditional Latino men believe that the men are supposed to ensure pain without pain and the elevating it would be unmanly and demeaning in eyes of their higher. Chinese people maybe avoid eye contact, making a pain assessment more difficult. Uh, it Italian, Jewish, American, and African American, and Spanish speaking people often smile rapidly and use a facial expression and gesture to communicate pain or displeasure. Irish, English, and Northern European people tend to show a poor facial experience and rare less responsive response, and especially in genres such as the professional caregivers. Evaluation of outcome goals, assess for the pain level, assess for the uh, effectiveness of the pain medication, evaluate side effects, sleep and rest. Patient rest feeling mentally relaxed, free from worry and physical pain. A patient and rest is free from the physical and mentally expression. Rest and sleep very important. State of rest and cure for the sustained period. Associate with the healthy suggests that the achieving optimal sleep and quality is important for the patient recovery. Restores the person injury and feeling of well-being. Factors affecting sleep: physical illness, anxiety, depression during the substance and lifestyle, sleeping pattern, stress environment, exercise fatigue, and nutrition. Stage of sleep. Stage 1, life-threatening, rapid eye movement, daytime sleepiness, safety precautions, set beds lower into the fall position and chance lower to the floor to lessen to the chance of patient and rest fall when first standing. Some patient and residents who experiences daytime sleepiness fall asleep while sitting up into the chair or wheelchair position is the person so that he or she not be fall off the chair while sleeping. During use the pain management, learning objectives. Medication. Encourage the patient to require a pain medication before pain escalates. Pain medication is effective with early treatment identified when last dose of the pain medication was admitted. Pain scale assessment used with the pain relief range order. Analgesics. 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 Classification according to the neurological neurological optical organ, opioid agent for severe acute pain, optical patient agonist for unrelieved or moderate acute pain, operator patient agonist for unrelieved pain, the moderate acute pain, failure of the peripheral organs, optical agonist acute pain, theory है antagonist ये है worse adverse effect to the opioid agonist. Cecilide, Cecilide for mild and acute pain. anxiolytics. Non-steroidal is the anti-inflammatory drug NSAID for mild acute pain. Tonsillitis for mild non-steroidal is the anti-inflammatory drug NSAID for the mild acute pain. Miscellaneous. When injury occurs, the body releases chemicals that contribute to the pain. Drug used to block this chemical include antihistamine, prostaglandin inhibitors, prostaglandin, prostaglandin inhibitors, and SABD medication, antidepressant medication is usually unnecessary. Patient control analgesics, like quicker relief than the patient does not have to wait for the nurse to administer medication. Patient control. Prepare a patient control analgesic. Tell the family member and friends not to operate the device for the patient. Epidural analgesia. Epidural glucagon is injection of the epidural catheter and the infusion of the opioid into the epidural space. Appropriate first line for the moderate to severe acute pain, expected to last for at least 24 hours. The nursing care patient with epidural infusion. Assess dressing, assess catheter, ensure the catheter remains in place. Change dressing for agency policy, monitor vital signs, pulse oximetry, monitor bowels and the bladder, assess for the side effects and administration, including the pleuritis, nausea, and vomiting. Administered medication is prescribed to manage the side effects. Elastometric pumps. Elastometric pump. Pain balls are used to admit local medication local inside of the ball admitted through a small catheter that has been placed beneath skin during a surgical procedure. अच्छा ये हुआ क्या? Inside the ball. The administration through the small catheter that has placed beneath and skin during a surgical procedure. Dosage of the medication may be set and provide continuous administration or it may be blocked for the patient. Necessary necessary doses and even allow demand balls and administration to event of the breakthrough. As the medication dispensed, the ball gradually began to soften and eventually appear. Drug class of opioid agonists. Action. Act on the same side into the brain as the morphine to stimulate analgesia effect to block the pain sensation to relieve acute chronic opioid medication rather than relieve the acute chronic pain. The moderate pain can be used to prepare pre-operating or supplement anesthesia. It can help reduce anxiety and create feeling well-being. Drug morphine and morphine like codeine, hydrocodone, oxycodone, and naproxen, like methadone, Clairvoyants, other opioid victims. napping. Common adverse effects for the lightheaded, dizziness, hallucinations, swelling, confusion, disorientation, and hypertension, nausea, vomiting, constipation. Most often cited as severe adverse effect respiratory depression without administration, urinary retention